Hello and welcome. I start by discussing the story of Sarah. Now, Sarah was a painter. She loved to paint and she loved to spend hours painting, with her paintbrush. She spent hours on her canvas doing her oil painting and she could paint different kinds of wonderful and beautiful looking pictures. And she did that for hours happily. She was about 32 years old as a lady somewhere in Mexico. Now it came to a time that she started to feel really weak. She was feeling weakness in her arms, in her stomach, in her wrist, especially the wrist she was using to do the painting. She was really feeling weak and she felt fatigued. Every time she just does a little activity, she feels really down. And so Sarah took a quick visit to the doctor and a scan was done. The scan was done on her brain. And when the scan was done, an MRI scan was done on her brain, the scan showed white patches. That's the film, the screen where on which the result was done, showed white patches on her brain. And she began to wonder what that was. And the doctor told her she was suffering from multiple sclerosis. So today we discuss multiple sclerosis. What is multiple sclerosis? Now, multiple sclerosis is an autoimmune disorder. It's an autoimmune disease that causes demyelination. Now, what do we mean by that? When you look at the multiple sclerosis affects majorly the central nervous system. Affects majorly the central nervous system, and the central nervous system is made up of the brain and the spinal cord. Now, within that central nervous system, we know that we have what we call nerve cells, and we also have what we refer to as nerve fibers. Now, these nerve cells and nerve fibers have myelin sheaths. So these myelin sheaths are part of the structure of the nerve cells and the nerve fibers, and they help them, to propel the signals across the nerve cell. Now, when you discuss multiple sclerosis, it's an autoimmune disorder, a condition in which there is the demyelination of these sheets, meaning that these sheets are destroyed. The immune system begins to attack myelin sheets. Not only does it attack myelin sheets, it destroys myelin sheets and it damages myelin sheets. And at the end of the day, when these nerve cells or nerve fibers become demyelinated, it becomes difficult for nerve impulse to move across these nerve cells and fibers. And when nerve impulses can't move across these nerve cells and fibers, then you know that it becomes difficult for messages to be sent. Now, when you look at this issue, you ask, what is the major cause of it? The truth is that science for now does not know the major cause of multiple sclerosis. But what science can say is that there are some predisposing factors. There are some factors that are risk factors. There are some factors that raise the probability that an individual, male or female, will suffer from multiple sclerosis. The first of such factors is age. With age, the immune system begins to lose its potency, begins to become weaker. And so many at times, some autoimmune diseases can take place. And so with age, a person is at a higher risk of coming down with this illness. Now, age, meaning that age is a predisposing factor for this illness. You also have genetic predisposition. So if you look at your family history and you see that some people have had multiple sclerosis in your family history, it puts you at a higher risk of having this. There is also the issue of environmental factors. If you're exposed to little or no sunlight so that you don't have enough vitamin D, and if you're exposed to some particular kinds of illnesses in your environment, they can predispose an individual to coming down with multiple sclerosis. And this is quite important to know. It's important to know that like I said, that there is no single cause for multiple sclerosis, but there are predisposing factors, there are risk factors that can put us at higher risk of coming down with this illness. Now, it's important to know that there are about four different types of multiple sclerosis, and these four different types are they are this type or multiple sclerosis is divided or classified on the basis of the kind of symptoms that multiple sclerosis brings forward. The first one is called a remitting relapsing multiple sclerosis. Remitting relapsing multiple sclerosis, that's RR. Now, this is a kind of sclerosis in which the illness comes with all its symptoms, and then after a time, it seems to abate. It seems like the person is getting better. with medication and with help and whatever it is. It's like the person is getting better and then it comes again. So it's like you have this vicious cycle where the disease comes and it goes and it comes and it goes. So relapsing remitting multiple sclerosis is a type of multiple sclerosis. We also have what we call primary progressive multiple sclerosis. Primary progressive multiple sclerosis is a type of multiple sclerosis in which the disease or the symptoms of the disease starts very small and it progresses over a long period of time. It continues to progress. The person continues to suffer from these different symptoms of this disease without it abating for any reason. The individual continues to suffer from this disease. You also have what we call the secondary progressive multiple sclerosis. And this kind of multiple sclerosis, it first of all starts as a remitting multiple sclerosis, and then it graduates gradually to a time when it now doesn't relapse again. It now doesn't remit again. Sorry, and you now have just relapsing, and the person just continues to suffer from the symptoms of this particular disease. Then the last one you have is the progressive relapsing multiple sclerosis. Excuse me, the progressing relapsing multiple sclerosis. And in this kind of sclerosis, you see that progressively the individual just continues to suffer from this disease and the symptoms of the disease continue to worsen. So the question to also be asked is, what are the possible symptoms of this disease? There are many symptoms of multiple sclerosis, and you have from weakness to fatigue to blurry vision to drooping eyes to difficulty in walking, difficulty in swallowing. You also have depression, mood swings, and imbalance, then difficulty with coordination and balance. The person finds it difficult to balance, to coordinate his movement and motion. All these are symptoms. But as we know, that a person shows these symptoms does not necessarily mean that the person has the disease. Diagnosis has to be done, diagnosis tests have to be taken. Now, to diagnose multiple sclerosis, there are a couple of tests that are taken all together. The number one is the MRI scans. Um, MRI scans are taken for the brain and the brain cells to check if there's any change. And then neurological exams are done to look at the person's the ability of the person to use the nervous system, how functional it is. And then lastly, a lumbar puncture or lumbar tap can be done to take samples of cerebrospinal fluid. And when samples of cerebrospinal fluid are taken from the suspected individual, those that fluid is taken to the laboratory and tests are run to try to identify the presence of antigen antibody complexes in the cerebrospinal fluid. And if these complexes are present, it's an indication that there's some kind of immune response taking place within this fluid. So all these together are used to diagnose for the presence of multiple sclerosis. It's important to note that multiple sclerosis has no particular treatment. It's an ailment without a treatment, but there are many things that can be done to, try to alleviate suffering and to make the illness easier to bear for the individual. So you have different kinds of therapies, such as the use of steroids, such as other kinds of physical therapy, diet, the use of steroids. These are some of the things that can be used to help the person. Also, a lot of lifestyle modification can be used to help the individual to protect him and alleviate sufferings from this illness. So that brings us to the end of our discourse. We've talked about multiple sclerosis, which is a type of autoimmune disease. I hope you've gotten one or two things from this. And remember to like our content, share our content. Remember to ask us questions, suggest topics to us if you have followed us all up to this stage of the video. Have a wonderful day, and it's beautiful speaking with you.